Welcome back to Premed Academy. Today we're continuing the MCAT Psych series. We are talking about the disorder that affects 1% of the US population and can include hearing voices. So let's hit it off. Today we are learning all about schizophrenia. And we're going to start off with a quick practice question. All right, here we go. Question number 1. Which of the following is a positive symptom of schizophrenia? Is it A, avolition, B, flat affect, C, delusion, or D, alogia? I'll let you think about it. If you can answer it, that's great. But first, we're going to learn a little bit more and then come back to this question. So what is schizophrenia? The definition is a prototypical psychotic disorder, which means you have psychosis, involving delusions, hallucinations, disorganized thought, disorganized behavior, and negative symptoms. You may have some, but not all of these descriptions necessarily in order to meet the criteria for schizophrenia. And in our prior lesson, we touched on the DSM criteria for schizophrenia. This is the manual that allows us to diagnose people based on their symptoms. So you typically have these delusions, hallucinations, disorganized speech, disorganized behavior, or negative symptoms. There must be some form of dysfunction in your life. As we talked about psychiatric disorders, there must be dysfunction or limitations in daily functioning. And for schizophrenia, there must be these symptoms for at least 6 months total in order to have this diagnosis of schizophrenia. You don't need to worry about the nitty-gritty details of the DSM criteria, but just know that you need at least 6 months to meet this criteria. Now let's talk about the positive and negative symptoms of schizophrenia. So positive symptoms means plus something weird. You are adding odd behavior on top of normal behavior. So you might have delusions, which we'll dig into, hallucinations, disorganized thought, disorganized behavior. All of these are additions on top of normal behavior. And in terms of negative symptoms, this is the loss of normal stuff. So you are subtracting or taking away normal behavior. So you might have a flat affect, avolition, anhedonia, alogia, and social withdrawal, which we'll dig into a little bit deeper. But a person that is schizophrenic can exhibit both or either positive and negative symptoms. So let's take a deeper dive into the positive symptoms of schizophrenia. Delusions are the first, and these are false beliefs that are strongly held despite clear evidence against them in real life. So there are several different types of delusions. We will just briefly touch on them. You can pause and read this later, but persecution means that you think that people are out to harm you. Grandeur means that you think that you are powerful or have a high status. Reference, you believe that everything is referred back to you. Maybe there's unrelated events, but you think that they're directed at you or they're about you. Thought insertion, you believe that other people can insert thoughts into your head or place thoughts into your head. And finally, you have thought broadcasting. Think of, you have a loud microphone and everything that's in your head is just being projected or blasted out into the world. So you believe that your thoughts are being heard out loud by everyone else around you. So if we look at some of these examples, persecution, maybe you think, hey, the FBI is following me. Grandeur, maybe I am the chosen one, I am super strong, I'm the only one who can control the weather out there. If you have reference or delusions of reference, you think that everything refers back to you. So maybe there's a billboard as you're driving down the highway and you think that the messages on the billboard are about you, or maybe there's a TV or radio show going on and you think that people are sending messages out of the TV just to you. There's thought insertion. Maybe you think that doctor is putting thoughts in my brain. They're inserting these waves of thoughts into my head. Or you have the thought broadcasting, which is everyone in the room can hear my thoughts, or everyone around me in the nearby area is hearing what I'm thinking, or they can hear it out loud because it's just coming out of my head. It's spilling out. So those are delusions, which are more beliefs. Now we move on to another positive symptom, which is a hallucination. These are perceptions that are not due to true external stimuli. There isn't anyone talking out loud. There isn't anyone whistling out loud. But for some reason, you feel that these noises or auditory hallucinations or visual hallucinations are real. So the most common hallucination in schizophrenic patients are auditory. They tend to hear voices, which can be inside or outside of their head. And these voices are most often saying bad things. They might say bad words to you. They might put you down, or they might even command you to do bad things. You can also have other types of hallucinations, such as visual. You might see things, tactile, you might feel things on your body that aren't there. You might smell, you might taste things that aren't there. But overall, the most common hallucinations are the auditory for schizophrenic patients. Schizophrenic patients also have disorganized thoughts. So a couple different thoughts that might go through someone's head. Loosening of association. So these are ideas that shift so quickly in and out that the person listening is not really able to follow the train of thought. Just the ideas don't make sense together. Like here you see, I took a train. Do you have time? Speaking of which, I like apples. My dog is purple. They're just saying a bunch of different ideas that are not connected. And if you were trying to listen to them, it would not make any sense to you as to where they're going with that conversation. They might have word salad. So this is words just thrown together and they don't have any comprehensible meaning. So you can't even form a full sentence. It might look like running, lamp, strange, fish, dog, two, star, bees, right. So no full sentences, just random words put together. You might have neologism, which is the invention of new words. So these people might start coming up with new words. Like here, this person says, it's time to eat the flibbles. And you're like, what on earth is a flibble? I have no idea. So these are some of the disorganized thoughts that patients with schizophrenia might exhibit. And there's others, but these are kind of the core things that we hear about. From there, we move on and talk about disorganized behavior. Again, this is still a positive symptom because you're adding on an odd or bizarre behavior on top of normal behavior. So for example, these patients might no longer be able to perform activities of daily living like clean their house, clean themselves, because their thought process is disorganized. That leads to then disorganized behavior, aka they can't organize their life. They may have catatonia, which are abnormal movements. Sometimes people might be rigid, stiff. They might not be able to move their body. They just might be frozen. Or they might have useless or bizarre movements that are repetitive, that make no sense, that are not really goal directed. You know, it's not like I'm reaching for a cup and trying to pick it up and drink. They might just be swatting the air and there might not be any goal or anything there. Something else you might see in schizophrenic patients is echolalia, or repetition of someone else's words. I say hello, you say hello back to me. I say, what's your name? You respond with, what's your name? So a lot of repetition, just mimicking what the other person is saying to you. And then the last thing is disorganized behavior, echopraxia. So instead of imitating words, you are now imitating another person's actions. They might wave, you wave back. They might bend over, you bend over. So that is kind of imitating words and imitating actions of another person. Again, all of these are kind of abnormal behaviors, abnormal movements that don't have a specific purpose or end goal in mind. The next thing we'll talk about is negative symptoms. So these are the opposite. Remember, negative symptoms, you are subtracting away from normal behavior or normal daily activities. So a person in this case would have a flat affect. An affect just means emotion. So if someone's flat, they have no emotional expression. If they're happy, you can't tell. They are just at baseline, unresponsive, flat face. They might have inappropriate emotion or inappropriate affect. So this means they display emotion that does not align with what they're saying. So a person might be telling you, hey, my father died yesterday, but at that same moment, they might be laughing out loud hysterically. So the behavior of laughing isn't really aligning with what emotion they should be feeling. You know, someone passed away, you should be sad. So those two things are inappropriate or disconnected from one another. You might have avolition, which is a lack of motivation or goal-oriented action. So this is where you might see patients with schizophrenia not able to take care of themselves. You might see anhedonia, which means just no pleasure. No matter what activities you do, whether you used to enjoy hiking or you used to enjoy watching movies or eating cookies, nothing brings you pleasure anymore. You might have alogia, which is poverty of speech. They might start having slowed response to questions or might not be able to produce speech at all, or may only respond to, a yes or no question and nothing else. And then lastly, you will start seeing asociality. So a lot of social withdrawal, being alone, staying at home alone, not wanting to be around people. All of these things are taking away from normal behavior, subtracting, and these are what the negative symptoms of schizophrenia might look like. Okay, so now it's your turn. Let's take a stab at a couple practice questions. Let's go back to which of the following is a positive symptom of schizophrenia? Is it A, avolition, B, flat affect, C, delusion, or D, alogia? You can pause, think for a second, come back to the question. And our response here is delusion. Remember, avolition is no motivation. You're taking away from the normal behavior. Flat affect is being flat in emotion, having no emotion, so that's negative symptom. And then delusion is when we add on those fixed false beliefs. It is in addition to your normal behavior, you start having bizarre thoughts. So that is the delusion, and that is a positive symptom. And alogia is a lack of speech. So that is a negative symptom we're taking away. Now, one thing I briefly want to touch on is a concept in sociology you will see questioned quite often on the MCAT, the downward drift hypothesis. So this is a concept that suggests that schizophrenia leads to a decline in socioeconomic status and not the other way around. So let's look at the latter here. A person might develop schizophrenia, but before they developed schizophrenia, maybe they were doing just fine. Maybe they were able to hold a job, function normally in society. But then now that they have these symptoms of schizophrenia, they move further down the ladder. They have difficulty holding a job, maintaining relationships, affording their own care, and they lose their job. They go into social isolation because they are starting to maybe experience negative symptoms and total dysfunction in society. And then 3, they might drift down to a lower socioeconomic group due to these symptoms of schizophrenia, and they might even become homeless. So it doesn't work the other way around. It's not that someone is homeless or a low part of socioeconomic status and then they become schizophrenic. No, it is someone gets diagnosed with schizophrenia, and due to those symptoms, they start having social dysfunction that leads them to the lower rung of the socioeconomic ladder. The timeline of schizophrenia development, the typical onset for men is particularly late teens to early 20s, whereas for women, it is around late 20s to early 30s. It is very rare to see a person before adolescence, before their teen years, be diagnosed with schizophrenia. And it is also very rare to see someone just have new schizophrenia after the age of 40. If they are presenting with psychotic symptoms after the age of 40, then you should likely think more about a medical cause of their dysfunction rather than a psychiatric cause. Now, one thing that's interesting is there are studies out there that have shown that people who were born blind do not develop schizophrenia. I'm going to let you research that on your own time, but I thought that was an interesting fact. Maybe there haven't been any cases found, but for some reason, as far as I know, congenitally blind people have not developed schizophrenia. So that's just a fun fact. Another thing to think about is the prognosis or the outcome. You know, who has a worse outcome in terms of being diagnosed with schizophrenia? So people that have a slow onset of schizophrenia have a worse outcome, whereas a sudden onset have a better prognosis or better outcome. So the way I like to think about this prognosis question is think about cancer, right? Let's say that there is a cancer that is slowly growing throughout your body and it spreads to the rest of your body, and you don't really develop symptoms until really, really late into having cancer. But at that point, it has spread to your entire body. So your outcome there is really, really bad. But if all of a sudden you start having abdominal pain and you start throwing up and you start losing weight and it happens very quickly and you go to the doctor and you get diagnosed and the tumor or the cancer is still very localized, then you have a much better outcome because you can give medications, you can do chemotherapy, you can do surgery. So I just use that analogy of cancer. Spreading slowly equals worse outcome, whereas being diagnosed super suddenly at a very early stage equals a better prognosis, better ability for us to solve the problem. So think of schizophrenia in that way as well. And one of the final things we'll touch on is the prodromal versus the active phases of schizophrenia. So the prodrome of schizophrenia, think about this as like a warning sign. These are the warning signs that might tell you, hey, someone will likely develop schizophrenia. During this time, it might be, for example, in high school or early 20s when someone starts having some abnormalities from their normal behavior, right? Maybe they were functioning totally normally in all of high school and senior year. All of a sudden, they start withdrawing, they start not really being emotional, start having bizarre behaviors. Maybe they can't do their homework anymore when they used to be an A student all the time. Basically, subtle behavioral changes. These symptoms are before that psychosis, before the full-blown diagnosis of schizophrenia. And you can start looking at those signs to potentially predict if someone will develop schizophrenia. And then you finally reach the active phase. So this is when you have the full-blown delusions, hallucinations, disorganized behaviors and thoughts. And this is our onset of psychosis. This is where we have the psychotic symptoms that indicate that we are going to likely get a full diagnosis of schizophrenia. So think of prodrome as the warning signs before we get the active full-on schizophrenia. All right, let's touch on a couple more questions here. A patient hears voices and believes the government implanted a chip in his brain. He rarely speaks and shows no emotional expression. Which symptoms are positive and which are negative? I'll give you a couple seconds here, read the questions, pause the video, and come back. So the correct answer here is B. Voices and delusions are positive symptoms. We are adding onto normal behavior, and flat affect, which means no emotion or not really showing any emotion on your face, is a negative symptom. We're taking away from normal behavior. Question number 3, a patient believes that a popular news anchor is sending them secret messages through the evening broadcast. This belief persists despite evidence to the contrary and has led the patient to avoid watching TV altogether. Which type of delusion is this most consistent with? Pause the video, read the answer choices, and select your choice. And the correct answer here is C, delusion of reference. Maybe you got confused here, but let's run through these. So persecution means someone's out to get me, right? The FBI is after me, my neighbors are after me. So that doesn't really fit here. Delusion of grandeur means I think that I am amazing. I am a Superman. I have powers that nobody else has. I'm super strong. Delusion of reference means everything that I see on TV or maybe on a radio broadcast or on billboards or everything around me, I think refers to me. Maybe the billboard says something that's totally, irrelevant, but I think it's always pertaining to me. So this is what this evening broadcast is sending me secret messages that are specifically for me. And then the last answer is thought broadcasting. So think of a big speakerphone and you are basically projecting all of your thoughts out into the area around. So people around you can hear your thoughts because they're being broadcasted around you. Thanks for staying tuned. So our key takeaways: remember the positive and negative symptoms of schizophrenia, the common delusion types and hallucinations. And the MCAT does love the timeline of schizophrenia development and sociological context, so make sure you're aware of the downward drift theory. And with that, thanks so much for staying tuned in. Don't forget to follow and subscribe. If this video helped you, hit that like button, leave us a comment, and we look forward to seeing you in the next episode where we will be talking about depressive disorders. If you want to check out Premed Academy, we focus on community, education, and coaching. You can find the link in the description below.